Valvular heart disease. The heart valves play a very important role in ensuring that blood flows in the correct direction through the heart. In patients with valvular heart disease, the damaged valve or valves affect the flow of blood. The symptoms of valvular heart disease will vary depending on which valve is affected. Even after a valve problem has been diagnosed, patients may go many years without developing any symptoms. If symptoms do develop, the condition can be treated to give you a better quality of life. How to live with valvular heart disease. Depending on the valve affected by your valvular heart disease, and particularly if symptoms are brought on by exercise, it may be necessary to pace yourself, listen to your body. If you cannot maintain a conversation when exerting yourself, you're working too hard. Remember, graded exercise is good for the heart. Try to avoid very hot or very cold temperatures. Weight problems put extra strain on the heart. It is like carrying a sack of potatoes on your back. It is difficult to reduce your weight unless you modify your diet, eat sensibly, and take regular exercise. What you eat and drink is very important in managing your heart disease. It should be low in cholesterol, fats, and salt. The diet should be well balanced and include many different types of food. Control your alcohol intake. Give up smoking. Ensure you see your GP and arrange vaccinations against influenza and pneumonia. Lifestyle. The secret is accepting change. Although making lifestyle changes is difficult, your future relies on these changes. They will all help to improve your quality of life. Can you still work? If so, is it feasible to work full-time or part-time? Can you continue with your hobbies? Most patients can, but you may need to pace yourself a little more. If you are excessively tired, slow down. As regards your sex life, do not be frightened. You can have normal sexual intercourse when relaxed. However, do try to avoid a heavy meal before sex. Communicate with your GP, cardiologist, and rehabilitation nurse before starting any regime of physical exercise. Relaxation. Set aside time each day to relax. This also gives time for the heart to relax. For some patients with valvular heart disease, in order to help ensure a good night's sleep, consider using plenty of pillows, opening the bedroom window, weather permitting, avoiding naps and heavy meals before bedtime, taking diuretics in the morning unless the doctor tells you otherwise. Stress affects the body, and although it does not directly cause heart problems, indirectly it may be a trigger by inducing anxiety, anger, palpitations, hyperventilation. These can make your conditions worse. However, trying to avoid such triggers and setting aside time each day for relaxation will help to control your condition. Exercise. Regular exercise is good for the heart. It helps the heart pump more efficiently and will improve your condition. A diagnosis of valvular heart disease does not make you an invalid, so do not allow friends and family to treat you as such. However, remember that occasionally you may be overexerting yourself, and so listen to others when they recognize this. When exercising, avoid lifting weights and competitive sports or contact sports. Avoid exercising in extreme temperatures because the body has to work harder to keep the temperature normal. Avoid sunbeds, saunas and jacuzzis. If you develop chest pains, shortness of breath, lightheadedness, rest. Review your activities and lower the workload. Wear loose-fitting clothes that help a good blood flow. Consider a cardiac rehabilitation program if you haven't taken regular exercise for a while. Cardiac rehabilitation programs. A cardiac rehabilitation program can help restore your confidence. Exercise is started at a very gentle pace and tailored to the individual patient's needs in a supervised setting. You will find over a period of time your exercise tolerance will increase. These programs often provide education classes and encourage other family members or close friends to attend. Smoking. Stop smoking. This will reduce your blood pressure, heart rate, and the furring up of the arteries. If you quit smoking, your condition will improve. Ask the practice nurse at your GP's surgery for advice on smoking cessation programs. Dental care and surgical operations. Abnormal heart valves are susceptible to infection, even when the valve abnormality is very mild. This infection is potentially serious and is known as endocarditis. Treatment of endocarditis requires several weeks in hospital and can be life-threatening. In order to reduce the risk of infection, it is important to ensure that your teeth and gums are kept healthy. Regular dental checkups are important. Dental treatments, such as scaling or tooth extraction, require antibiotics to be taken before the procedure to prevent infection. Surgical procedures other than dental work may also require precautionary antibiotics. Before any operation, it is important that you tell the doctor looking after you that you have valvular heart disease. The doctor will then make the decision as to whether antibiotics are needed to cover the operation. Protection against flu and pneumonia. These conditions are dangerous for people who have heart disease. The body is deprived of oxygen, and so the heart has to work extra hard and becomes tired. The following guidelines will help to protect you. Ask your GP if it is necessary for you to have a yearly influenza vaccine and a one-time pneumonia vaccine. Try to avoid people suffering from colds or the flu. Avoid crowds in the winter months when coughs and colds are around.